Hello, healthcare professionals. Welcome to my YouTube video. In this session, I want to guide you through the essential steps of ensuring bedside safety checks in the ICU. Dealing with critically ill patients requires us to be prepared for the unpredictability of their conditions. A thorough and proactive bedside safety check is not just a routine, but a vital start to each shift. Let's start with the equipment check. Our oxygen cylinders deserve more than a quick glance. Ensure they fill to the brim with oxygen. No compromises here. It's about being prepared, not just going through the motions. If your patient has a tracheostomy, it's essential to check for the bedhead sign and ensure the presence of a fully stocked emergency kit by the bedside. No details should be overlooked. Moving on from the tracheostomy box is a critical step is inspecting the bedside drawer. Confirm it contains the essentials, the C-circuit Mapleson, Liadol IMB bag, anesthetics face masks, heat and moisture exchanger filter, Gadol every sizes 2 and 3. Now, let's shift our focus to suctions. It's imperative to ensure an ample supply of younger suctions, verifying their functionality. Keep what available for maintenance. Additionally, check the closed suctions. They should be up to date and operational. Confirm that suction dishes are clean and not filled. These steps are crucial for maintaining an efficient suction system. Now, on to monitoring checks. Invasive lines is like a synchronized dance involving zeroing and transducer checks. The next crucial step is checking the transducer for both arterial and central venous lines. When dealing with patients lying down, position it at the level of the right atrium or mid-axillary line. Once in position, proceed to zero both lines on the monitor. Additionally, confirm the presence of non-invasive blood pressure attachment to the monitor for thorough monitoring. The AcuCheck or glucometer, our healthcare detective, ensures not just the present, it's rigorously quality checked and ready to use. Patient assessment, the core of our mission. Infusions and fluids akin to a carefully curated playlist must align precisely with the prescription. Additionally, ensure that all the lines and boxes are properly dated. Moving on to air entries. Air entries and bowel sounds are the vital symphony to which we are finely attuned. Name bands and allergy bands act as a VIP passes. Endotracheal tube cuff pressure, following the Goldilocks principle, should be just right. The skin bundle, acting as a superhero cape, assures our patients are fully prepared for the journey to health. Finally, prophylaxis, our silent guardians. ICU patients are highly susceptible to deep vein thrombosis and pulmonary embolism due to the factors such as prolonged immobility, complex medical conditions, and the use of medical interventions by catheters. This collectively increases the risk of blood clot formation and subsequent complications. As your nurses, we need to ensure that compression socks are worn, flow trombones are functional, and the patients are assessed for anticoagulant medications. Gastric ulcer and eye care. The Avenger standing strong against complications. We are not merely applying them, we are fortifying our frontline defenses. Today, we delve into the essentials of a bedside safety check, focusing on equipment checks, monitoring checks, patient assessment checks, and prophylaxis. These 4 points are your go-to at the start of each shift, laying the groundwork before you dive into the tip-to-toe patient assessment. It may seem daunting, especially for those new to the ICU environment. But here is the secret. With time and practice, you will master the bedside safety check in less than 5 minutes. If you are new to the ICU, be patient with yourself. With dedication, You'll soon breeze through these checks effortlessly. Stay tuned for more tips and tricks on healthcare mastery. Until next time, stay healthy, stay committed, stay curious. Thank you for listening. See you next time.